afternoon. It is my pleasure to join you as we mark the significant milestone for you, the family and friends that have joined you this evening. Today marks both a culmination and commencement. We look back on the dedication you have shown, the sacrifices made, and the knowledge acquired on the path to this ceremony. And we look ahead to the challenges and achievements that are before you. As you proceed, let me encourage you to carry on the fervent spirit of inquiry that brought you to this day. I encourage all of you to continue to believe in your own talents and visions and make your own contributions in the field of nursing. I join your family, friends, and mentors in applauding all you have achieved thus far and all you will achieve as a graduate of the UAB School of Nursing. We're very proud of you, and we look forward to your return as you continue your education in the future.
Hi, my name is Katie Paris. I'm the Assistant Dean of the Undergraduate and Pre-Licensure Program. Boy, how things have changed. Change always makes us long for the way things used to be. I sure wish that we were live together today so that I could tell you exactly how proud I am and what a wonderful nurse I think you're going to be in person. But we'll have to make do with what we have today. We're now going to begin with the awards. The first award, the Florence Nightingale Award, is given to the student who most exemplifies the high standards of nursing care. The award is named in honor of Florence Nightingale, who became widely known for her work during the Crimean War. At the invitation of the British Secretary of War, Nightingale and a group of carefully selected nurses worked to improve the conditions for the sick and wounded soldiers at the British Air Force Base Hospital in what is now called Turkey. For her efforts, she became known as the Lady of the Lamp. The lamp and its flame exemplifies Ms. Nightingale as a beacon for high standards of nursing care and work to improve the living conditions of the patients, communities around the world. The recipient of the Florence Nightingale Award is selected by the vote of the entire class. This person is one who, like Ms. Nightingale, serves as a beacon for the delivery of high-quality nursing care. By selecting a classmate as the recipient of the Florence Nightingale Award, each of you individually and as a class see the beacon and set a high standard to uphold throughout your own nursing careers. I challenge each of you to deliver every day the same high quality of nursing care with compassion, dignity, and thoroughness that you recognize in your classmate. Some statements made by the class members selected to receive this award are: they displayed high levels of professionalism, consistently dependable and prepared, welcoming, friendly, and team-oriented, exceeds expectations as a student, the nurse that if they were ever ill would want to see them at their bedside. It gives me great pleasure to present the Florence Nightingale Award to Ms. Francesca Aiello Cruz. Now please welcome Dr. Dana Mitchell to present the Renee Argensinger Commitment to Nursing Award.
The Renee Argensinger Commitment to Nursing Award recognizes a graduating BSN student who has demonstrated a commitment to achieving a BSN degree despite personal obstacles. This award is named in honor of Renee Argensinger, a BSN student who completed the nursing program while fighting a severe illness. Even though Renee had every reason to quit nursing school and focus on her family and her treatment, she was determined to earn her degree. Shortly before losing her battle with her illness, Renee achieved her goal of completing the BSN program and received her nursing pin. This award recognizes a senior BSN student who has demonstrated perseverance in completing their nursing education with a strong academic record, a history of leadership, and commitment to overcome complexities in the classroom and the clinical settings. Today's recipient has demonstrated resilience throughout her time at the UAB School of Nursing. Despite personal challenges that would present a barrier to anyone, this student has persevered to complete a rigorous nursing program. She's been actively involved in the Student Nurses Association and is respected by faculty and peers as a reliable leader. Her compassion and attention to detail leave no doubt that she will be an excellent nurse. Having now completed her bachelor's degree, this student will begin her nursing career in the neonatal ICU at the University of Florida. It is with great pleasure that I recognize Ms. Noelle Ingram as the recipient of the Renee Argesinger Commitment to Nursing Award.
Good afternoon. I am excited to present the Douglas M. Horn Emerging Nurse Leader Award. This award was established in 2019 by the School of Nursing in recognition of Mr. Douglas Horn and his generosity. Mr. Horn is a BSN alumnus of the UAB School of Nursing and graduated in 1973. The award is voted on by the recipient's classmates and recognizes a deserving BSN student who exhibits outstanding leadership qualities both in the clinical and classroom settings. The award recognizes someone who demonstrates compassion and shows a positive attitude to the profession and to others. It is my honor to tell you about this semester's recipient. This student was described as someone who exudes care and compassion to everyone she meets. She is a cheerleader for the entire team and also a team player. In addition, she is an advocate for patient and family-centered care. Her dedication is evident in her academic performance and extracurricular activities. It is evident she is very dependable, a consistent leader who models great leadership characteristics, which makes her deserving of this recognition. So I would like to present the Douglas M. Horn Emerging Nurse Leader Award to Ms. Palmer Miller. Congratulations to all of you.
Good afternoon. I'm Emily Craig, Director of Alumni Relations here at the School of Nursing. It is a privilege to be with you and to congratulate you. I'm here to recognize a student for their outstanding work representing not only your cohort, but also the School of Nursing during interactions with our donors, potential donors, and alumni. This student has helped our supporters understand the impact that their giving makes in the lives of our students, as well as promoting the school. She has spent time with and thanked our scholarship donors, as well as has assisted with alumni and donor events. She has represented our school at events and activities in a professional and positive manner, and dedicated extra time outside of her rigorous academic endeavors. We appreciate this student's willingness and effort, so today it is my honor to recognize Ms. Palmer Miller. All of you have done amazing things, and we all look forward to seeing what you will accomplish as alumni. Congratulations. Now please welcome Dr. Kayla Blakely, who will now present the BSN Award for Student Excellence.
Hi, I'm Dr. Kayla Blakely, and I am a 3-time UAB alumni, 2 of those being from the UAB School of Nursing, and I'm also the Nursing Alumni Chapter President. First of all, I'd like to say congratulations to each of you and welcome to an elite group of nursing alumni. Our profession always needs exceptional nurse leaders, and we know UAB produces the best. So I urge you to always strive to be lifetime learners and community leaders the way I know you were taught to be. One thing I've learned that is a highly educated nursing world is a really close-knit group. You never know when and where you will meet and have the opportunity to work with a fellow UAB nursing graduate, but you will. They are all over the globe and they are making things happen. Because of that, I want to encourage each of you to stay connected and involved with our school after you graduate. There are several ways to stay involved, but an area close to my heart is the Nursing Alumni Chapter. Our chapter is a great way to network with fellow nursing colleagues in our communities, in the state, and across the world. The Nursing Alumni Chapter hosts several events throughout the year, both here in Birmingham and across the country. These are often fun and engaging. I encourage you to attend everything that you can. The chapter also enjoys supporting our school and recognizing our outstanding students. So today, it gives me great pleasure to announce the recipient of the Nursing Alumni Chapter's BSN Award for Student Excellence for the summer 2020 semester. This student was described by her faculty nominator as an exceptional student and dedicated leader who exceeds expectations. She is poised, mature, responsible, and professional. She is an honor student and mentors incoming students as well. In addition to her studies, she has served as the class representative for the Student Nurses Association with a great deal of responsibility, accountability, and ownership. She has worked tirelessly to organize and maintain collaborative relationships and partnerships within the organization. With confidence, she will continue to represent the UAB School of Nursing in an outstanding manner. It is my honor to present the Nursing Alumni Chapter's BSN Award for Student Excellence to Ms. Palmer Miller. Congratulations to you all. I look forward to having you as fellow alumni.
Good afternoon and welcome. I'm Summer Powers, Faculty Advisor to the Student Nurses Association, and now I'd like to present the SNA Leadership Awards. The UAB Student Nurses Association is a division of the National Student Nurses Association, which boasts a membership of over 50,000 nationwide. This organization mentors professional development of future registered nurses and facilitates their entrance into the profession by providing educational resources, leadership opportunities, and career guidance. Our chapter at UAB is very active and participates in a multitude of school, university, and community service projects. I'd like to take this opportunity to share some of those with you now so you can see exactly what our student leaders have been up to this year. They have facilitated many drives and activities in collaboration with community partners. They've participated in health screenings across campus and the community. They've participated in many campus events, including recruitment, health fairs, career fairs, orientations, and UAB Day. They have hosted many School of Nursing events, including Senior Recognition Ceremony, Lamp of Learning, BSN orientation, and information sessions. And quite frankly, this is only to name a few. Not to mention, they've done all of these things while pursuing and achieving academic success and excellence at a School of Nursing that is nationally ranked. We are honored this afternoon to recognize those students who have served as role models for our organization and for our school, and are delighted to have them join us as colleagues. I will begin by recognizing the following board members: Francesca Cruz, Class Representative; Madison Bowman, Public Relations Co-Chair; Noelle Ingram, Merchandise Co-Chair; Palmer Miller, Class Representative. In addition to recognizing our board members, we would also like to recognize some of our outstanding members. Over the past 2 years, these students have not only been a part of our organization, but they have also contributed extra hours of service. We are very appreciative of the time and energy that they have dedicated to help our organization have a successful year. The following members have received recognition as outstanding members: Stephanie Gerardo, Taylor Gilly, Sarah Hathaway, Kelsey Ho, Francie Pulia, Noelle Russo, Catherine Thomas, Brianna Velasquez, Kanisha Ware, Amelia Webster, Monica Yalamati. Congratulations, guys. Thank you so much for your service.
Hello, my name is Dr. Leanne Bray, and I'm the co-director of the UAB BSN Honors Program. The Honors Program strengthens the education of nursing students via introduction and application of nursing research and quality improvement over the course of 3 semesters. Honors students complete all regular BSN requirements as well as the additional research and quality improvement training, including a 90-hour immersion experience. Honors student teams work alongside nurse scientists and clinicians with a primary mentor to guide their experience. The students' project is then presented at the UAB Undergraduate Research Expo. In this venue, students from all across the UAB campus compete in a poster competition. This year, with the unprecedented changes due to COVID, due to the COVID crisis, students participated in the expo using a virtual platform. I would like to now recognize the students who have successfully completed the BSN Honors Program by reading their names, the titles of their projects, and acknowledging their mentors. Taylor Alford, Noelle Ingram, and Ami Nanji. Bereaved parents' experiences after infant death in the neonatal ICU, implications for nursing care. Mentored by Dr. Marie Bakaitis and Dr. Aaron Curry. Stephanie Arnold and Ashley Johnson. Weight, body image, and health-related quality of life in cystic fibrosis, mentored by Dr. Leanne Bray. Caitlin Bosshart. 9 South Communication and Teamwork Improvement, mentored by Dr. Shannon Layton. Sarah Hathaway and Caitlin Smith. Blood and Babies, Determining Women's Opinions on Whole Blood Transfusions, mentored by Dr. Allison Jones. Erin Hollis and Monica Yalamati. Cognitive Reserve and Brain Neuroplasticity, a Lifestyle Lifespan Perspective, mentored by Dr. David Vance. Abby Knight and Yangling Zhu, Fertility Preservation in Women with Cystic Fibrosis Pre-Lung Transplantation, mentored by Dr. Sigrid Ladoris. Palmer Miller and Noelle Russo, Associations of Breakfast Consumption and Daytime Sleepiness in Adolescents, mentored by Dr. Sylvie Mrug. Jarius Spivey, Evaluation of a Mobility Program, mentored by Dr. David James. Danielle Stewart, An Interdisciplinary Approach to Preventing Pressure Ulcers in the Inpatient Setting, mentored by Dr. Shannon Layton. Mary Kate Terry and Amelia Webster, Hospital Staff Compliance with Baby-Friendly Health Initiative, the Delay of Breast Pump Setup, mentored by Dr. Shannon Layton. Finally, I would like to present the Outstanding Honors Award. This award is a distinction that symbolizes academic excellence, professionalism, and service. This year's recipient is not an individual, but a team that demonstrated passion, enthusiasm, and dedication throughout their 3 semesters in the honors program. Their work culminated in a project focused on identifying barriers to the implementation of evidence-based practice surrounding the Baby-Friendly Health Initiative, which helps promote the early initiation of breastfeeding. Results from this project stand to help minimize identified barriers and improve compliance to the initiative in the clinical setting. Their engagement was also evident in their coursework as they sought early faculty feedback on both their abstract and poster, helped faculty navigate the virtual undergraduate research expo submission process, and participated in optional activities, including a mock job interview. Both students not only exhibit academic excellence, but also embody the UAB School of Nursing core values of excellence, caring, innovation, diversity, collaboration, integrity, and communication. It gives me great pleasure to present the Outstanding Honor Student Award to Mary Kate Terry and Amelia Webster. Please join me in applauding all of our Outstanding Honor students, as well as the faculty mentors and dedicated staff who have guided and supported them in their academic pursuits. It has been my honor to serve as your faculty, and I'm thrilled to greet you as my newest colleagues in the nursing profession. Congratulations.
We would now like to recognize these students who were recently inducted into Sigma Theta Tau International, the only honor society for nursing. These students have achieved academic excellence while at the university and in their nursing coursework. Taylor Alford, Stephanie Arnold, Anna Avery, Isabella Bentecourt, Caitlin Bosshart, Madison Bowman, Claire Brantley, Addison Cox, Allison Davis, Christina Giles, Alexis Hardrick, Sarah Hathaway, Bethany Henry, Aaron Hollis, Maggie Holsclaw, Tyler Heasey, Noelle Ingram, Sharika Jordan, Abby Knight, Rose Lambert, Hannah Lee, Megan Marquette, Alexa Mazizriz, Brittany McEwen, Palmer Miller, Amy Nanji, Morgan Osborne, Helen Randall, Noelle Rousseau, Jordan Sapier, Jiria Spivey, Danielle Stewart, Mary Kate Terry, Katie Thomas, Brianna Velasquez, Amelia Webster, Olivier White, Monica Yalametti, and Yangling Zhu. Thank you and welcome to Sigma.
Good afternoon. My name is Dr. Deborah Bowers, and at this time I would like to recognize the Summer 2020 Registered Nurses in Primary Care Scholars. The RNPC Scholars Program is funded by a HRSA grant and provides academic instruction and hands-on fieldwork experiences for students who are interested in primary care nursing. The UAB School of Nursing strives to improve the quality of life for all Alabamians. Through targeted programs such as the RNPC Scholars Program, the school is devoted to increasing the number of primary care nurses in the state of Alabama and building a resilient primary care registered nurse workforce for chronic disease prevention and control. The program goals are to enhance access to care, reduce the cost of services, improve the health outcomes of medically underserved individuals throughout the state. Participation in the program is competitive. Please join us in recognizing and congratulating the Summer 2020 RNPC Scholars for successfully completing the program. I would like to recognize the following students: Anna Avery, Mason Fitzgibbon, Haley Hemming, Aaron Hollis, Maggie Holsclaw, Arian Hudson, Morgan Osborne, Jasmine Sistrunk, Claire Turner, Brianna Velasquez, Hannah Williamson. It has been a privilege to be part of your nursing journey.
We would now like to recognize the students who participated in the VA Nursing Academic Partnership between the Birmingham VA Medical Center and the UAB School of Nursing. These students were selected after a competitive selection process. The VA Nursing Academic Partnership with the UAB School of Nursing began in 2009 as one of only 15 sites in the nation and was implemented to increase the awareness among undergraduate nursing students of veterans' healthcare issues, to increase familiarity with veterans' health-related issues among all nursing students, and to increase the number of bachelor's-prepared RNs in the VA's inventory. These students have conducted the majority of their clinical rotations in the Birmingham VA Medical Center and have gained an appreciation for healthcare issues related to our nation's veterans while working on a robust electronic medical record, conducting quality improvement projects to increase the efficiency of the VA healthcare team, and to improve safety and reduce length of stay among veteran patients. Students are being recognized here: Caitlin Bosshart, Francesca Cruz, Taylor Gilly, Abigail Knight, Jasmine Sistrunk, Jabrell Smith, Claire Turner, and Kanisha Ware.
Good afternoon. I'm Dr. Rhonda McLean. It is now my pleasure to recognize the graduates who participated in the Veterans Career Advancement in Nursing, or VCAN program. The Veterans Career Advancement in Nursing program was originally funded by a grant from HRSA and is now supported by the School of Nursing. The The VCAM program provides academic and social support for veterans, active duty, National Guard, or reservists wanting a career in nursing. Participants in the program represent all branches of the military. Since the VCAM program began in 2014, 40 past or current military members have entered the profession of nursing through UAB School of Nursing. As director of the program, I'd like to recognize the following VCAM graduates: Francesca Ilo Cruz, Jabrell K. Smith, Kanisha D. Ware. Congratulations and thank you for your service.
The next speaker was nominated by the students to give their final address. Please welcome Dr. Summer Powers.
Oh, hey, I didn't see you there. Sorry I couldn't make it to graduation today, but I'm at the beach doing a little light reading. But I heard you wanted to hear me speak. So I sat down, I tried to write, and I failed. I mean, I was unsuccessful at my first attempt. And then I was unsuccessful at my second attempt. And then it hit me. You don't want to hear me speak. You want to hear me sing.
Well, you can tell by the way I squeeze my bag, I'm a UAB grad, ain't trying to brag. The defibrillator's loud and the pads are worn, wanna be a nurse since I was born. Now it's all right, it's so great, you know how to defibrillate. You passed your test, you got through pharm. Remember Florence said don't do no harm. If you're going to psych or OB, your patients be staying alive, staying alive. If it's the ICU, you're gonna see they're gonna be staying alive, staying alive. Staying alive, staying alive, staying alive.
But on a serious note, Ralph Waldo Emerson once said, "Life's about the journey and not the destination." And wow, what a journey it has been, especially in the last few months. I've always told you to be Gumby, but did you ever have this in mind? I certainly didn't. I know you never want to hear the words "be Gumby" again, but your ability to do so has helped shape you into the young professionals you are today. Molière once said, "Perseverance, the greater the obstacle, the more joy in overcoming it." You have all most certainly overcome many obstacles to get here today. From the early days of trying to learn to take a pulse, not knowing if it was your lab partners or your own that was going at 150 beats per minute, to learning how to work the defibrillator for the first time. I'm clear, you're clear, oops. Some of you know all too well about this, I won't name any names. To learning how to navigate virtual nursing school. You've managed to overcome and survive it all. What an amazing experience it has been to watch you grow and learn in your skills, education, and confidence as you transition from novice to expert student. Going from the apprehensive new student asking for assistance to apply a blood pressure cuff for the first time, to the confident new clinician high-fiving me in the hall after leading a code on a simulated patient. Wow, what a difference 2 years, even a few months can make. Today, you're no longer students, you're graduates and young professionals who are entering the nursing workforce. You will join more than 15,000 alumni from the UAB School of Nursing who practice in a variety of areas all across the United States and the world. There has never been a more critical time in our healthcare delivery system for the intricate, holistic, collaborative, expert care of high-quality nursing professionals, and I am beyond delighted to have you join me as colleagues in that capacity today. So what now? When it comes to the future, there's 3 kinds of people: those who let it happen, those who make it happen, and those who wonder what happened. I'm confident that you will only be one of those kinds of people, the ones that make it happen. You're now a UAB graduate, instilled with the core values of excellence, caring, innovation, collaboration, diversity, integrity, and communication. When you leave here today, you will infuse your education and skills into a variety of settings in a multitude of locations. Have you ever heard the quote, "tiny but mighty"? I remember the first time I came in to teach your class, looking at my watch and asking, "Where is everybody?" And I remember you laughing and telling me, "This is it." As I got to know your class more, you began to remind me of a quote that hangs above my daughter's bed. "And though she be but little, she is fierce. Let her sleep, for when she wakes, she will move mountains." Time after time, we were in lab or class, and I would ask a question or present a scenario. You were giving me answers before I could even finish my thoughts. Wow. Blown away. Tiny, but mighty. That's you. We all know the journey of 1,000 miles begins with the first step, and you're going to take that first step today. I've tried very diligently to reflect upon my journey as a novice nurse and think about all the many things I wish I would have known. If I were to swap places with you today, here are a few things I would say to myself when embarking upon a new nursing career. First, it'll take time to learn, and you will be scared. I'll never forget my first tour of the intensive care unit that I was going to be employed on. There were more lines and tubes and machines than I could count, and I was like, "Psh, no big deal. I got this. Bring it on." Kidding. Quite frankly, I was terrified. It's okay to be scared. Never let your confidence exceed your competence. However, be assured that you've been educated in a world-class medical institution and a school that ranks among the top 5% in the nation. You have worked collaboratively with multiple healthcare disciplines, both through simulation and clinical experience. I mean, the first time I ever coded a patient, it was a real one, with a resident who turned to me with tears in his eyes and said, "What should we do?" Awesome. But I'm confident that you're going to know the answer to this question. You're prepared more than you think, but you also have much to learn, and it's going to take time. It was about a year into my novice nursing career that I could actually drive to my shift without experiencing palpitations. Be patient. It will come to you. Second, never stop learning. I really hate to break the news to you, but tests and validations don't end today. They only begin. They just disguise them and call them something fancy like annual competencies. Nursing, medicine, and healthcare change daily. You should know that firsthand in the last few months. Some of you will become future nurse scientists and will contribute to this evolution of medical knowledge. This means that you've signed up to become a lifelong learner. As a patient advocate, a nurse must always know the current standards and guidelines. Do what it takes to keep up. Strive to learn more. Seek further education through certifications and grad school. You are the future of nursing knowledge. Third, use your resources. Find a good resource person at the beginning of every shift that you trust. Get a good drug guide that you can easily navigate. Do not sell back your nursing books. And I'm assuming by your response, some of you have already violated this. Remember, a good nurse does not know all the answers, but they know where to find them. Be resourceful. Seek answers. Learn from your colleagues. Fourth, there will be days you feel defeated. Don't worry. These days are fleeting. They will pass. Don't let these days overcome your passion for your profession. And then there will be days you'll be on top of the world. Remember these days. These are the ones that drive you to continue. And finally, never say, "I am just the nurse." Just the nurse. Just the person who is with the patient 24/7. Just the person who watches every heartbeat, every breath. Just the person who knows more about that patient than any other member of the healthcare team. Patients don't come to the hospital to see the doctor. They come for nursing care. You're not just the nurse. You're the expert clinician, the primary provider of care, and the patient advocate. Hi, my name is Summer. I am the nurse taking care of this patient today. So in summary, I'd like to leave you with some words of wisdom from a very famous doctor, Dr. Seuss, slightly modified. Congratulations, today is your day. You're off to great hospitals, you're off and away. You have brains in your head, you have feet in your white shoes. You can steer yourself any direction you choose. You're on your own, and you know what you know, be it skills or farm or the challenge of patho. You'll look up and down charts, look them over with care. And about some, you'll say, "Oh, I better go straight there." With your head full of brains and your shoes full of feet, you're never too busy to miter every bed sheet. And out there, codes can happen, and frequently do, to people as brainy and footsy as you. And when codes start to happen, don't worry, don't stew. Just go right along and remember the ratio. 30-2. Oh, the places you will go. You'll be on your way up. You'll be seeing great sights. You'll join nursing organizations and make healthcare policies right. Your assessments won't lag behind because you'll have the speed. You'll pass the NCLEX and you'll soon take the lead. Wherever you fly, you'll be the best of the best. You're a UAB grad, you will top all the rest. Oh, the places you will go. There are I's and O's to be done. There's charting to be completed, and sometimes it won't be fun. The speed with which you answer your patient's call will make you the winningest winner of all. Awesome. You'll be as awesome can be. And you will become a personal nurse to all your friends and family. But I'm afraid that sometimes you'll have lonely days too. Days you can't win, because you'll play against you. All alone, whether you like it or not, alone will be something, you'll be quite a lot. And when you're alone, there's a very good chance you'll experience things that scare you right out of your pants. There are some down the road between hither and yon that can scare you so much you won't want to go on. But on you will go, though the attending's mood will be foul. On you will go to inquire about movements of the bowel. Onward up many a frightening creek, though your arms may get sore and your medication vials may leak. You'll get drug classes mixed up, of course, as you already know. You'll get them mixed up, but with your drug app, you'll soon be ready to go. So be sure when you step with great care and great tact, and remember that nursing's a great balancing act. Just never forget to be dexterous and deft. Never mix up your patient's right foot with their left. And will you succeed? Yes, you will indeed. 99 3/4% guaranteed. Graduate, you'll move mountains. So, whether you're headed to psych or community or OB, or whether it's the ICU you want to see, you're off to great hospitals. Today is your day. Your shift is waiting, so get on your way. Congratulations. I wish you the best of luck.
We would now like to recognize the students graduating August 2020. Morgan Atkins will be working at UAB on the cardiothoracic surgical unit. Taylor Alford will be working at UAB on the GI surgical oncology unit. Stephanie Arnold hopes to find a job in pediatrics. Aaron Ash hopes to find a cardiovascular intensive care unit position in the Birmingham area. Anna Avery will be working at UAB on the cardiopulmonary critical care intensive care unit. Selena Benefield will be working at UAB on the medical intensive care unit. Isabel Bentecourt will be working at St. Vincent's Birmingham on the cardiovascular intensive care unit. Alex Boozer plans to work at UAB on the medical intensive care unit. Caitlin Bosshart will be working at the Birmingham VA Medical Center on the surgical ICU. Madison Bowman will be working at Children's of Alabama in the neonatal intensive care unit. Claire Brantley will be working at Children's of Alabama in the cardiovascular ICU. Reginald Broadnax will be working at UAB in the Hospitalist II unit. Lei Xuan hopes to find a job on the labor and delivery unit. Addison Cox will be working at UAB on the Hospitalist COVID unit. Francesca Cruz will commission and serve in the United States Army Nurse Corps. Alexis Daniel hopes to find employment in the Birmingham area. Allison Davis hopes to find a job in the Birmingham area. Megan Fable will be working at St. Vincent's Birmingham in the cardiovascular intensive care unit. Mason Fitzgibbon will be working at UAB in the emergency department. Savannah Francis hopes to find a job at UAB in the GI surgical oncology unit. Christina Giles will be working at Children's of Alabama in the specialist care unit. Taylor Gilley will be working at T.C. Thompson Children's Hospital of Chattanooga in the neonatal ICU. Leslie Galat will be working at UAB on the surgical intensive care unit. Katie Habich will be working at UAB on the medical intensive care unit. Alexis Hardrick will be working at UAB on the medical intensive care unit. Sarah Hathaway will be working at UAB on the neurology, stroke, and surgical step-down unit. Haley Hemming will be working at UAB Highlands in the emergency department. Ashley Hennings will be working at UAB on the acute trauma care unit. Bethany Henry will be working at UAB in the general medical infectious disease unit. Kirsten Hetzler will be working at UAB in the neurosurgery and stroke step-down unit. Kelsey Ho will be working at UAB on the cardiopulmonary critical care unit. Aaron Hollis is currently interviewing for several positions at UAB. Shayla Holman will be working at UAB on the neuro-intensive care unit. Maggie Holzclaw hopes to be accepted into Nashville's nurse residency program. Zai Luan Hong hopes to find a job at UAB Hospital. Ariane Hudson will be working on the Pulmonary Care Unit 10 quarterback at Children's of Alabama. Tyler Hussey will be working at Children's of Alabama in the Neuroortho Unit 10 Harbor. Noelle Ingram hopes to be accepted into the new graduate nurse residency in Colorado Springs, Colorado. Alicia Jennings plans to move to a surrounding state with hopes of finding a job and becoming a travel nurse. Ashley Johnson will be working at UAB in the neurosurgery and stroke step-down unit. Tommy Jones hopes to find a job in the emergency room and eventually become a travel nurse. Sharika Jordan will be working at UAB in the trauma burn intensive care unit. Stephanie Gerardo Garcia will be working at UAB in the gynecology oncology unit. Malia Kirk hopes to find a job in the Birmingham area. Abby Knight will be working at UAB on the labor delivery unit. Rose Lambert hopes to work at UAB on the trauma burn intensive care unit. Rhea Langford will be working at UAB on the coronary care unit. Hannah Lee will be working at UAB on the medical intensive care unit. Kit Lovell will be working at UAB on the surgical ICU. Megan Marquette hopes to find a job in the Birmingham area. Alexa Mazarias will be working at UAB in the cardiothoracic surgical unit. Cameron McClendon will be working at UAB in the vascular and endovascular surgical unit, M7. Brittany McEwen will be working at Huntsville Hospital on the oncology unit. Madison McKee will be working at UAB on the GI surgical unit. Mallory Means will be working at UAB on the gynecology oncology unit. Palmer Miller hopes to find a job in the Birmingham area. Kaylee Montgomery will be working at UAB on the neuroscience intensive care unit. Ami Nanji will be working in the critical care unit. Madeline Oliver will be working at UAB in the trauma burn unit. Morgan Osborne will be working at St. Vincent's 3 West. Audrey Porter will be working at UAB on the Interventional Cardiovascular Unit. Saya Poe will be finding a job in the Birmingham area after graduation. Gabe Pritchett will be working at UAB on the Abdominal Transplant Unit. Francie Puglia will be working at UAB in the Cardiopulmonary Intensive Care Unit. Helen Randall will be working at the Birmingham VA Medical Center in the Medical ICU. Cameron Rogers hopes to find a job in the Birmingham area. Noelle Russo will be working at UAB in the Acute Trauma Care Unit. Madison Sanders will be working at UAB on the Labor and Delivery Unit. Jordan Sapier will be working at UAB on the Medical ICU. Lauren Shoemaker hopes to find a job in the Birmingham area. Jasmine Sistrunk will be looking for a job in the Birmingham area after graduation. Gabriel Smith hopes to find a job in the Birmingham area. Caitlin Smith will be working in the Mother-Baby Unit at Baptist South Hospital in Montgomery. Jariah Spivey will be working at UAB on the P9 unit. Danielle Stewart will be working at UAB on the Medical ICU. Mary Kate Terry will be working at UAB in the GINX unit natural birth class. Katie Thomas has accepted a job at Jackson Hospital in the emergency room. Morgan Thomas hopes to find a job in the Birmingham area. Claire Turner will be working at the Birmingham VA Medical Center on the Medical ICU. Coy Tyler will be working at UAB on the Cardiovascular Intensive Care Unit. Brianna Velasquez will be working at UAB on the Medical Intensive Care Unit. Kanisha Ware will be working at UAB on the Adult Cardiovascular Surgery Step-Down Unit, S5 South. Amelia Webster will be working at Children's of Alabama in the Neonatal Intensive Care Unit. Olivia White will be working at the Grandview Medical Center Emergency Department. Vajarian Williams will be working at UAB in the Neuroscience Neurosurgery Nursing Unit. Hannah Williamson will be working at UAB Highlands Hospital. Monica Yelamati will be working at UAB Hospital in the MICU. Yan Ling Zhao hopes to find a job in the Cardiovascular Intensive Care Unit. Please welcome our next speaker, Dean of the UAB School of Nursing, Dr. Doreen Harper.
Congratulations to you, our wonderful graduates and newest nursing colleagues. You have made it, and you've distinguished yourself as a graduate of one of the top nursing schools in the country. What an accomplishment. On behalf of the faculty, I want to thank all of the families and friends who've provided you support to complete your degree. Today, we celebrate our newest Bachelor of Science in Nursing graduates. And you have had a journey unlike any other program I've ever seen in nursing education. I am impressed with the array of communities and experiences represented here. 130 graduates are being recognized. This includes 93 who are eligible to become new registered nurses and another 37 who are already registered nurses. Your class is made up of 118 students from Alabama, 1 from Colorado, 3 from Georgia, 2 from Florida, 2 from Mississippi, 1 from Kentucky, 1 from North Carolina, and 2 from Texas. As you know, never have nurses been more important as we are today, on the forefront of the COVID-19 pandemic. While the COVID-19 situation continues to change daily, the one thing you continue to see are nurses leading high-quality, compassionate care across populations worldwide. In fact, for the 18th year in a row, nurses have been identified as the most trusted profession by the Gallup poll. UAB nurses in this global health crisis are no different. They are leaders, providing frontline care as integral parts of interprofessional teams across every facet of the healthcare system, from the executive level to the bedside and everywhere in between. You are entering the workforce as a leader in nursing at a time when healthcare is changing. But each of you are well prepared to provide the highest quality care for patients, families, and communities. You now are our future leaders who will tackle the world's greatest health and patient care challenges, much like COVID-19. As a graduate of the UAB School of Nursing, you've been educated in a world-renowned academic health science center that is ranked 7th in its master's program and 10th in its Doctor of Nursing practice program among public schools of nursing in the country. And our graduates are seen worldwide as catalysts for innovation, advancement, and new discoveries. I want to leave you with one question as you enter the nursing profession. How will you transform health for the patients and communities you serve? You have a big job. You are up to it. Now, to the task at hand, the Florence Nightingale Pledge. Florence Nightingale, in the mid-1800s, established the core values that guide the standards of nursing practice to provide highest quality health care that protects and promotes human dignity. Students, I would like you to join me and a number of your faculty in reciting the Nursing Pledge. I solemnly pledge myself before God and in the presence of this assembly to practice my profession faithfully with the full knowledge of the responsibilities I am undertaking. I promise to care for my clients with all the knowledge, skills, and understanding I possess. I will respect at all times the dignity and beliefs of the patients under my care and hold in professional confidence all personal information entrusted to me in the practice of my profession. I will refrain from any action that might endanger the life or health of my clients and will endeavor to keep my professional knowledge and skills at the highest level. With full awareness of my qualifications and limitations, I will do my utmost to uphold and elevate the standards of the nursing profession, as well as give my support and cooperation to all members of the healthcare team.
Good afternoon. On behalf of the Summer 2020 graduating class, I would like to welcome all of our family and friends in joining us on this special occasion. First, congratulations to each and every one of you on this beautiful day. I am beyond grateful and honored that you have chosen me as the Florence Nightingale recipient. To me, she represented perseverance in a time of chaos and overcame fear to pursue her love of saving lives. Her contributions to the world led us to what we define as modern nursing today, and I will strive each day to embody her spark of light in others. To the amazing family and friends, we thank you for your love and encouragement that you expressed since the beginning of our nursing school journey. You supported us as we went through some of the hardest moments in our lives, and maybe even witnessed us go through all 5 stages of grief and just one phone call. You were there when we needed a good cry and there to celebrate a win. Your faith in us never went unnoticed, and today we stand united as one family to highlight such a proud accomplishment. As a class, we went through so many unique, challenging, and sometimes painful learning experiences. To the instructors and administrators that dedicate each day of their own lives so that we can fulfill our dreams, we thank you for your mentorship, for providing creative ways to make learning fun, and for being our advocates. Today's senior recognition ceremony wouldn't have been possible if you didn't fight to get us in the door. When so many hospitals closed the doors to other nursing schools across the country due to the pandemic, you provided us with the peace of mind that we will graduate on time. You kept your promise, and we thank you for all the sacrifices you continue to make. The first day of nursing school, on January 7th, 2019, we all came together in one classroom. And I think it's safe to say many of us were strangers to one another. But over time, something magical happened, and that is we became this unbreakable team. We learned to depend on each other and ask for help without hesitation, supported one another through panic attacks while sitting outside of Lister Hill before a test, and even waited almost 45 minutes after that test for a fellow classmate to get done so that you could cheer them on. We celebrated birthdays, engagements, holidays, and weddings together. We endured personal hardships like getting sick, taking care of those who were sick, and losing someone we loved. In the darkness of this pandemic, we continued to adapt in our learning experiences while serving critically ill patients and their families across Birmingham, Alabama. My wish for you is that you continue to do the things in life that gives you passion and purpose. You had a choice to be anything you wanted when you grew up, and you chose the nursing profession. Let that reason drive you to make the lives of others around you a better place. Continue to stand up for what's right in the face of adversity. Advocate for others who are unable to sit at the table, and never let anyone discourage you from achieving your dreams. Share your knowledge, and if you make a mistake, own up to it and do better next time. Take care of your patients, your team members, and yourself. Always be kind to others and enjoy life each day as you can. I want to share a special thank you to my mom in heaven for being my inspiration. I dedicate everything I am and will be to her. To my sister Laura, all family and friends, I love you and thank you for your prayers. To my husband, Manny Cruz, who gives my life new meaning each day, I love you. Lastly, to all my classmates, you are the best part of my nursing school story. I am so proud of you. You deserve this moment and so much more. Until next time.
Thank you for being with us today. Congratulations to you all, and we are so proud of you.